Hi there, my name is Shannon Pigott and I am the creator and founder of Genesis Breed Specific Healthcare. Hey, we get a ton of questions about how can I implement breed specific wellness in my practice. So I want to share just with you a few tips to help you get started. Number one, identify the number of breeds that you have in your practice, but prioritize them according to the numbers that you see the most of. For example, it'd be really hard to implement a hospital-wide breed-specific wellness program for 400 breeds. Why don't you just start with 3 to 5? So that's tip number one. Tip number two, and assuming that you've already identified the top 3 to 5 breeds in your practice, is to get your team excited. It's going to be really hard for you to implement breed-specific wellness for 400 breeds if your team isn't on board with you. So if you can assemble a work team together, maybe pick those top 3 breeds and ask your team to say, what do you know about this particular breed? Well, let's just say you pick a Schnauzer, for example. Most of your employees would say, wow, they're prone to pancreatitis. Well, excellent, that's right. If you can educate them on the other diseases that they're prone to, they're going to have more robust conversations with clients. They're going to provide more credible information to clients, and that's going to increase the value that your team delivers. All right, so we're moving on to tip number 3. Tip number 1 was pick 3 to 5 breeds. Tip number 2 was get your team excited, motivated, and involved. Tip number 3 is to create wellness plans for those 3 to 5 breeds. From this point forward, let's just say 5 breeds, just to make it simple. Well, the wellness plans will say the breed at 6 months of age would get X, Y, and Z, and then at 2 years of age might get another series of diagnostics, evaluations, or physical exams throughout its entire life. Now, I'll tell you, we have worked at Genesis for the last 5 years to create wellness plans for the top breeds. It does take a lot of work. We do already have wellness plans, and we do already have client handouts so that you can talk to clients expertly about the predispositions. But you know, it's not rocket science. You can certainly do the work to create these wellness plans. All you need to know is, what does the pet need starting from maybe the first visit at 6 weeks of age and maybe the last visit, which could be at 12 years, 15 years, 18 years, or 22 years, depending upon the breed and the species. If you'll sit down with the team, plan out what you're going to offer, then what you can do is either put it on a sheet of paper so clients can read it, put it in your database so you can create an estimate or a healthcare plan when the client is in. It will then serve as the template for your discussions. Okay, step number 4. Step number 4 is simple. Just get started. There are so many practices, and believe me, we have Genesis customers all over the world. What I find really often is that people think, oh, it's not perfect, or I need to spend a little more time on it. No, you just need to start having the conversations. If you've developed your wellness plans, you've motivated your staff, and you know which breed you're going to focus on, the next thing to do is just start having the conversations. In the beginning, it might fumble just a little bit. You might not exactly know, do you talk about predispositions first in the exam room, or do you do physical exam, handle the primary complaint of the client, and then talk about predispositions? You're going to have to find your own system, but the most important thing in this step is just get started. Okay, step number 5. Step number 5 is to measure your success. Now at this point, you should have already been talking about wellness plans and genetic predispositions in these top 5 breeds. You should have already had your team motivated. You should have already completed your wellness plans, and you should have already started. You're actually talking to clients about it. You know, but now we need to look at what kind of impact have we had. You know, generally they're easy things. Measure the number of shimmer tear tests that you have conducted versus a previous period. Look at the number of IOPs, maybe the number of x-rays that you've taken, the number of thyroid profiles that you sent out, the number of urinalysis that you sent out for breeds predisposed to bladder stones. There are a host of things that you can look at. You know, it'd probably be helpful that you think a little bit in terms of the quality of life that is improved through making these recommendations. And the best way to do that is to measure how many diseases you've diagnosed and or how many times you've tested an animal for a genetic predisposition and it came up negative. That's still a success. So here's where we have come from. First, we picked our top 3 to 5 breeds and we settled on implementing breed-specific wellness for 5 breeds. The next step that we took was we rallied the troops. We got everybody excited about what we were going to do. The third step was that we created wellness plans. The fourth step was that we got started. We actually started talking to clients about it. And then the fifth step was that we measured some success. So you may be wondering, what do I do next? You build plans. You add more breeds. Now I'll tell you, it takes a little bit of time to get this system in place. You've got your computer that you need to work through. You've got your staff that you need to train. You have materials that you might want to use. But after you have built those, the next thing to do is to add breeds. Listen, I've talked to a lot of people who have said, I've started but I haven't been able to finish. Or I found that it was just too much work for me to build all the breed plans and create handouts. If you're interested in saving yourself a lot of time and implementing this sooner than you might otherwise on your own, I'd invite you to visit www.genesis4vets.com. We have a host of resources and a lot of information to save you time.